One of the single most important things you can do when getting pregnant, planning to get pregnant, or already pregnant, and you're hoping to have your dream labor and delivery is to find your team. Nowadays, there is so much information out there. We could get inundated with and overwhelmed on diet, exercise, doula, midwife, OBGYN. There's so many options out there. You're going to get all this unsolicited advice. So before we go into all this, the biggest thing I want to say is don't let anybody tell you what to do. Your mom. There is something to be said about mother's intuition. You know your body very best, and your body will tell you things that a doctor, a chiropractor, a doula, a nurse, a midwife cannot pick up on because it's within you. The first suggestion I would make is just get educated. There's a lot of times decisions are made as far as healthcare providers and options in pregnancy simply out of a lack of knowledge. When in reality, if you truly knew the options that were out there, there's a good chance you may choose something different. Um, I there's so many times I've been in this community long enough now, working with pregnancy and perinatal care that and being a chiropractor, people come into me usually leaning towards the more holistic side, natural birth, fewer or less interventions, and I'm on board with that. I'll never be one to tell moms what to do, what not to do. But then I will hear the team that's been gathered around them. I know this community well enough. I know the hospitals. I know the C-section rates for a lot of the OBGYNs in a lot of the hospitals. And I get these women that do want the more natural side. And then I hear what hospital they're going to and what OBGYN they have. And I just know that their birth plan probably won't get followed. Not because they, as the mothers, haven't done all their part. The team around them is just sometimes not supportive of that. I once spoke to OBGYN on a professional level, and he told me if he could, he would do a C-section for every single delivery, every single one, if he had his preference. And if that's the way you want to go, I'm not. There's no criticism there on the mother's side. But if you're going to a practitioner like that and you want the exact opposite, you can see where the problem is. That happens a lot of the time, and so that's where we just get informed. What is the C-section rate of the hospital you're delivering at? What is the C-section rate of the OBGYN? If you're going the more natural side, what is the rate of transfer to the hospital? Do they believe that the body is built to give birth as it was intended? Bodies are built to do that. Are they going to let nature take its course? What are the interventions they typically go to? There's a lot of questions to ask to be able to figure out if they align with you. Once you're informed, you can make a very comprehensive and well-educated care plan. When you present that to your healthcare provider, do they really listen to it? Do they really try to understand it, or do they try to push you their own way? You are entitled and you are allowed to have your own birth plan. Um, One thing I would consider if we are wanting to go the natural route, at least in this community, we've got amazing midwives. There's a lot of times midwives are trained and specialized to do things that OBGYNs are no longer trained to do. It gets to a certain point in labor where the protocol, even not for the OBGYN, but for the hospital, is to do the C-section. That's what they deem to be the best course of action. Where in reality, there's a lot of other methods to do and choose that allow for a more natural option with no risk, no problems with that. Um, that's another tricky part is the hospital kind of binds those OBGYNs in a lot of ways, not allowing them to make certain calls, even though they know it to be safe. It's just the rules of the hospital. So that brings up the option of birth centers or even home births. A lot of people can feel nervous about that, but yet again, I would encourage just looking it up for yourself, doing the research, knowing how to prepare, and you'll realize what the factors truly are as far as risk, safety, benefit. We're finding that a lot of these interventions are causing other interventions and are causing complications and taking power away from mom. There are times where that is absolutely necessary. I'm glad those safety measures are there, but I think a lot of times we run to them too quickly. And I actually, believe it or not, understand why the OBGYNs would go to it. They want to keep themselves safe as they want to continue practicing. And that's what they've been taught to do. That's what they know. And that's what the rules of the hospital are. But we don't even run across those things with the right birth team. The other thing I would consider that may be really, really overlooked is emotional support. That can come from so many places. Of course, family is an obvious one there. You've got to have somebody in your family that supports your birth plan, truly. The other thing I would suggest is doulas. Doulas are so beneficial. When you are actively in labor, your mind shifts into a different gear. You shouldn't have to be making these higher cognitive decisions or thoughts. That's what the doula is, to step in and be your advocate, be your emotional support, and allow you to labor as you should, um, and be able to intervene with the doctors and midwives to be able to help you execute that birth process like you'd want it to be. They can also, of course, be the emotional support. They can help you in times of intense pain. They can coach you through. You've If you've hired a doula, you will already talk to them a lot and been able to find out a plan when the going gets tough. That is so crucial for so many women to be able to fully do their labor and delivery like they'd like to. Now, last but not certainly not least, I believe that a good pregnancy specialty chiropractor is a part of that. I know I'm biased there. So for that reason, if you're listening to this, even if you aren't close to us or you don't want to come to us, please get a neurologically based pregnancy focused chiropractor. If your nervous system can talk to your uterus and ovaries, it's going to work better. We're going to contract in the right way at the right time. Structurally, if you're in line, baby will just simply have more room. They're more likely to be head down. They're more likely to be in the right position so that it is less painful and takes less time. It also means that labor will induce more naturally, typically. Now, if you're concerned or wondering if your nervous system is needing some help or some support in that way, please reach out to us again. Even if it's not us, we can find referrals for you. We'd love to do so. As a matter of fact, we are actually about to do a health talk here in the next month concerning chiropractic, labor and delivery, all things pregnancy, and the team that can and should support you. If you guys have any questions, please reach out and we'd love to help you.